Hello there, it's Eric Backer, New Zealand naturopath, author of Candida Crusher and creator of the CanXida range of yeast infection products. A question I get asked many times, many different questions regarding antifungal products in particular. Can your product CanXida Remove be used by children? So that's really the video today. Excuse me. So can this product be used by children? Well, it can, but it depends really on the child and on the dosage. So let me explain that in a bit more detail. A younger child will need a lot lesser dosage, for example, because they've got a lot smaller body mass. So don't give a whole tablet to a child that's, say, 4 or 5 years of age. Go down to your chemist or drugstore and get a tablet cutter, something that can cut the tablet in 3, 4, or even 5 or 6 pieces, and start with a very small piece. So I probably wouldn't really go any younger than about 3 or 4, because you've got choking hazards. But what you can do with very young children is you can actually grind the tablet up into powder. So crush it into a fine powder. You can put it in some kind of a kitchen blender or whiz, blend it up into a powder. I've got some patients who actually get a small piece of tablet, about a third of a tablet, throw it in a smoothie and blend it up for a young child. So, that's one way, but the taste is not so flash because there are a lot of bitter herbs in this product. So with a smaller amount, but even a powder, it can taint or make the product quite strong if you're going to make up a drink. You can, however, mix it in with some blueberries, for example, some rice milk, blueberries, maybe a little piece of kiwi fruit in there. Those are the sort of things that may change the flavour and texture if you're going to put CanXida in there. So you probably wouldn't want them much younger than about 3 years of age, but if you're dealing with 5, 6 or 7 years of age, you can easily go half a tablet. And sometimes half a tablet twice per day is no problem. But you may want to cut the tablet again into another half, because some children have problems swallowing, items. They don't seem to have any problem swallowing toys or building blocks or things, but when it comes to tablets sometimes. So what I did with my children, I used to have swallowing competitions. So they would get a treat. It could be some cherries or a sweet treat if, which one of the 3 boys would swallow the tablet first. So you'll be surprised how large a child can swallow an object. Swallowing mishaps occur with children when they get the tablet down into the wrong area, and they actually could get it down into the breathing pipe, even into the lung area. So you have to be very careful, particularly if they're fooling around or playing. If a child's very serious and swallows a piece of tablet with food, you'll have no problem at all. Sometimes older children have problems swallowing too, and in that case, again, you can cut it into smaller sections. I don't find that to be a real problem. So children can have the product. There's no reason why they can't. You just need to look at the dosage. The dosage is important. A child is best, I've felt, given a dose twice per day. So when they're at school, you'll often won't be able to get the lunchtime dose in. But during the holidays, you might be able to get 3 doses in. 3 doses is optimal for CanXida Remove for my antifungal. 2 doses per day is quite good too. But try not to go really beyond 2 doses. 1 dose is going to be effective, but not as effective as 2, and 3 will be very effective. So once you start having a 7 or an 8-year-old child, you can easily give a whole tablet per day. When they get around 11, 12, 13, you can give 2 tablets per day. But it also depends on the size of the child. Some children are quite big when they're young. One of my patients recently was a 10-year-old boy that weighed 52 kgs, so it's 104 pound. 104 pounds for a 10-year-old. So a child like that could obviously take 1 to 2 tablets per day, even though they're 10, bigger body size. So you need to really think about it. But don't be afraid of giving CanXida Remove, the antifungal, to a child, because it works exceptionally well for children. Thank you for tuning into my video.